As COVID has now been in the backdrop of our lives for over 2 years, respiratory and cardiovascular illnesses have become more pertinent and inspire a lot of new research. Recent studies have found that living close to an airport can in fact be detrimental to your general health. Professor Peter LaPuma teaches environmental and occupational health at the George Washington University. He retired from the Air Force in 2007, where he served as a bioenvironmental engineer.
10 years ago, if you told me that particulates can get into your lungs and affect your cardiovascular system, even your brain, I would have said, no, that's not possible.
Evidently, living in a heavily polluted area can have effects on the residents' health. Airports and airplane emissions can affect all types of people, but especially those who have pre-existing respiratory conditions.
I'm a clinical research coordinator for a rare lung disease clinic, and we primarily work with 2 different rare lung diseases. People who have these types of respiratory illnesses should try to live in places with higher air quality, so places that aren't polluted, such as like near an airport, because these emissions from things like jets and also car exhaust, things like that, can be really detrimental to the lung and can cause even worse respiratory outcomes.
Within the last decade, more studies have proven a link between elevated noise pollution in airports and cardiovascular diseases in nearby residents. However, aside from noise pollution, which can cause significant stress and anxiety, studies have found that the emissions can also have an effect on the cardiovascular system. This is because the particles are so small that they cross over into the bloodstream, ultimately leading to heart attacks and other complications.
Aircraft also uniquely put out something called ultrafines, which are really, really small particles into an area, and they are finding evidence that there is some health effects from people living in close proximity to airports. So that's relatively new information. We really didn't know that before.
Airplane takeoffs and landings are the most polluting points in the trajectory. Over the last decade, the body of evidence proving that fine particles have cardiovascular consequences has grown. Therefore, people exposed to large sources of burning fossil fuel can be more at risk of developing health issues.
It definitely puts you at a higher risk for developing worse respiratory problems, like the things, like I said, the shortness of breath, chest tightness, coughing, wheezing, asthma, things like that.
It even has, believe it or not, more severe COVID outcomes. So it turns out that in areas where PM, what we call PM 2.5, fine particles, are very high, we also find that the disease was made worse.
So, what are the solutions to some of the health problems that airports pose? Ideally, more regulations for air traffic and emissions would help improve the situation, but moving towards more sustainable energy options is the long-term optimal resolution. For SNPA News, Elena Walsh.